So my name is Oscar Flores. I'm a behavioral health therapist. I'm a clinical social worker by training, and I work at La Clínica del Pueblo. Been at La Clínica for over 6 years. And La Clínica, it's a community health organization based in Washington D.C. It was created by immigrants to serve people who have been displaced from their home countries due to political instability, and also poverty and war. Many of our patients immigrated to this area during the Civil War in El Salvador between the 1970s and 80s. And our approach to diabetes care, it's a holistic team-based care. Because of our patient population, many don't speak English, many have very underinsured or no insured. And also other social determinants of health, such as poverty, very limited access to healthy food, ongoing stress, a prolonged history of trauma. We see that a lot in our patients. So we have a whole host of social determinants and psychosocial determinants of health. So that's why our care team is composed in a way that we assess our patients in different areas of needs that impact their health. Place do matter like I say, in every jurisdiction, every community is different. For our patient population, like I say, we do have safety nets in Washington, D.C., the D.C. Alliance, very minimal healthcare, access to primary care, medication, but like I say, there's no access to behavioral health. So that also is a barrier. Because we have limited resources, in a community that is complex with multiple needs, multiple barriers. So we, La Clínica, we cannot do everything by ourselves. So we rely heavily on our partnerships. In our community health program, La Clínica does take a big, that's their main role, is to bridges with other community partners. So that way we can support patients access food, access legal aid. Many of our patients, like I said, have immigration status that also plays a big role in their wellness. It's very difficult to stabilize someone who has chronic stress when the stress still going on. So that's why I depend heavily on our care coordinators for referrals for immigration, for access to food, for access to medication as well. We have some patients that don't have insurance, so we had to make sure that we had to find other ways to access medication. All of these pieces together, our aim is to provide all the resources that the patient needs so we can see better outcomes in their health. Like I say, health outcomes are not depending on the diagnosis, are also depending on whether the patients and their environment and the access or the lack of access to resources, and usually healthcare resources. When COVID started, so it's been 18 months, almost 2 years. So that was a big change. I've been a clinical social worker for 7 years. I never imagined, what came after COVID-19. It was a big change in terms of how we deliver care. So we were moved. We had to modify operations. So we were moved to work from home. But we continue to make sure that our patients were connected to us and to our services. Before that, we already had a mental health program. So for the behavioral health team, it was an easier transition because we already had some sort of like a structure. So it was an easier transition. It did affect our workflow. We did it because we were not in the same space. Our collaboration coordination was more challenging, so we had to develop new protocols, new procedures to making sure that we preserve our essence, which is team-based collaboration and coordination. During COVID, not only we saw the horribles of the pandemic, but we also saw the cracks in the healthcare system, and in general, who has access to what. Many of our patients, because of the immigration status, didn't really have any sort of financial relief, like many Americans did. The stimulus check, many of our patients, I would say the majority that didn't get it. Many of our patients were impacted by COVID directly because they're essential workers, so they had to go to work. We're trying to lessen the barriers and the impact of it. With the COVID, it just got magnified because of like I said, because of the who has access to what.